Welcome back. Today we'll talk about the correct medical approach to nosebleed. Blood vessels in the nose emerge from behind and they meet in the front. And they get smaller and smaller as you go from behind to front. So in the back we have large vessels, and in the front we have small vessels that connect together. The front area where the vessels connect is known as the Kesselback area, and this is the most likely area to bleed. The bleed would be minimum and would eliminate in a few minutes, as the vessels are very small and cannot produce all that much blood without clotting. However, in the back we have large vessels, so bleeding that occur here in the back will produce large amounts of blood and will continue bleeding for longer times. If someone is having a nosebleed, regardless be it from the front or back, they should tilt their head forward. The blood will form and accumulate around the nostril and will ease the clotting. If somebody tilts their head backward, the blood can easily go down the esophagus and into their stomach, and they can swallow large amounts of blood without even knowing. Once somebody tilts their head forward, they should squeeze the nostrils together from the cartilage area, not from the bony area. Make sure to close both nostrils together, even if the bleeding is only coming from one. Continue squeezing the front of the nose for at least 5 to 10 minutes. A very common mistake is somebody that would close their nose and then release their fingers to see if the bleeding stops. This will only make it worse. Just keep it closed for 5 to 10 minutes, and even better for 15 minutes. If you really want to be thorough, you can place an ice compressor on the nose bridge. This will narrow the vessels and minimize the bleeding. You should see a doctor or go to the ER if the bleeding is very severe and large amounts, or if the patient becomes pale and fatigued, or if the bleeding persists actively for more than 7 minutes, or if there is a history of nasal pathologies like tumors or surgeries, or if there is a frequent bleeding, especially unprovocative ones. The causes are the most common: nose pricking, continuous exposure to dry air, continuous use of nasal decongestants, and of course common cold. And here's a small quiz. Which of the following blood thinners is frequently used and safe during pregnancy? And the answer is heparin. Alright guys, that's all I have. Thank you so much for watching, and don't forget to subscribe.